PAD, which stands for peripheral arterial disease, is obstruction of blood flow to the legs. It's also could be considered obstruction of blood flow to the arms as well. PAD is caused by the same cholesterol buildup, which causes blockages in the coronary arteries. Probably only about 30% of people have what are called typical or classical symptoms. Pain and cramping in the legs when they walk. Often patients experience fatigue or heaviness. They'll say, "Gee whiz, doctor, my legs feel like lead." The risk factors for PAD are essentially the same as for coronary disease. These include high blood pressure, high cholesterol, smoking, diabetes, and family history of vascular disease. Of course, the number one risk, as with heart disease, is smoking. If PAD goes untreated, certainly it can substantially alter the patient's lifestyle and make it very difficult to perform the activities of daily living. In extreme cases, PAD can progress to loss of tissue and gangrene. As with any medical condition, the diagnosis of PAD starts with a good history and physical examination. Typically, the patient will have very difficult to feel pulses in the legs, in the feet, behind the knees, and the groin. The simplest test for PAD is something called an ABI, which stands for an ankle brachial index. The ABI is simply a fraction. It's the blood pressure in the ankle divided by the blood pressure in the arm. Other more extensive testing for PAD includes vascular ultrasound, CAT scans, MRAs, and what's considered the gold standard, which is an angiogram where X-ray dye is actually injected directly into the artery, and we're able to see where the blockages are and how severe they are. Often the only treatments available for PAD would have been surgical procedures or medical therapy for patients who were not candidates for surgery. Today, we have many minimally invasive techniques. Much of the technology which has come out of our treatment for coronary artery disease. We have balloons and stents. We also have what people refer to as roto-rooters or atherectomy catheters that actually remove the plaque from the arteries. We have special balloons that deliver anti-renarrowing drugs. We have lasers. We have devices that allow us to cross long 100% blockages of the arteries. All this technology is advancing and changing very quickly. Here at Deborah, we're uniquely situated in that we have access to virtually all this new technology. In addition, we are involved in multiple investigational and research protocols, which also gives us access to the very latest in technologies. We treat blockages in the carotid arteries. We can now fix aneurysms without surgery. We treat blockages to the arms, to the kidneys, blockages in the big vessels that feed the legs. And we also can aid in what's called limb salvage, where we can actually open up the very small vessels below the knee to hopefully limit amputation or avoid amputation altogether. Unlike most places where the treatment of peripheral vascular disease with these new technologies is a relatively new area, we've all been doing this for a number of years and literally have thousands of cases under our belt. Currently, it's estimated that over 90% of patients who have PAD are not even diagnosed. Of the 10% that are diagnosed, only about half of those, or 5%, are actually being treated. So we feel it's our duty here at Deborah to raise awareness of PAD. We have a screening fair coming up very soon. This is not going to be a one-time event. We will have multiple screening events during the course of the year. At the PAD fair, there's going to be screening for the disease itself. If that screening is abnormal, you'll be given the opportunity to sign up for an appointment with a physician at Deborah Heart and Lung Center. We will also have multiple types of educational materials. We will have mini lectures. If you're interested in being screened, please call Deborah at 609-621-2080 or log on to Deborah.org. Thank you very much.